Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and today in ENT we will talk about epistaxis. We divided our lecture into 4 sections. In the first section we will discuss about the causes and the site of epistaxis. So we will talk first about what is epistaxis. And then we will discuss about some local and general causes of epistaxis. And then different sites of epistaxis, we will talk about them also in this section. Then in the second section, we will discuss the blood supply of the nose and especially the nasal septum, the lateral wall of the nose, and we will discuss about the little's area, which is the area from which the epistaxis mostly takes place. And then we will talk about retrocolumellar vein. Then in the third section, we will talk about the classification and management of the epistaxis. And besides this classification and the normal management of epistaxis, we will talk about some first aid steps what should be performed to treat or manage epistaxis. Then in our fourth and final section, we will talk about the procedure which is performed to treat this epistaxis, which is commonly known as SRO or submucous resection operation. What is submucous resection operation? How we can do ligation of vessels and embolization. And also we will talk about one another very important condition, hereditary haemorrhagic telangiectasia, which can lead to epistaxis. So all this will be covered in our today's lecture topic, epistaxis. To learn about this, keep watching sqadia.com.